Group 4, LaDonna Connor, Samantha Noel, and Paula Stott present a peer discussion on multicultural perspectives and diversity issues as related to ethics and legalities in the counseling profession. Our textbook, Issues and Ethics in the Helping Professions by Corey et al., 2020, divided Chapter 4, Multicultural Perspectives and Diversity Issues, into 9 learning objectives listed above. Samantha covered the first 3, LaDonna the next 3, and Paula the last 3 topics. Within this topic are many terms important to understand. The 3 featured here form a good base. Culture, introduced in the textbook as a lens through which life is perceived, is defined as being associated with racial or ethnic groups, as well as, but not limited to, gender, age, religion, sexual orientation, socioeconomic status, political views, physical and mental cognitive abilities, geographic region, and the historical experience with the dominant culture. Multiculturalism, any relationship between and within 2 or more diverse groups, takes into consideration the specific values, beliefs, and actions influenced by a person's cultural experience, providing a conceptual framework that recognizes the complex diversity of a pluralistic society and bridges of shared concern, binding different cultured individuals to one another. Culture-centered counseling is a 3-stage developmental sequence ranging from multicultural awareness to knowledge and comprehension to skills and applications that lend an understanding of the client's behavior in context. You are encouraged to familiarize yourself with the entire chart of multicultural terminology featured on pages 108 and 109. When identifying how cultural encapsulation is an ethical matter, the problem of cultural tunnel vision must be addressed. Cultural tunnel vision occurs in counselors who, perhaps overwhelmed by cultures that are complex and multi-layered, overlook or oversimplify the client's issues. This perception of reality causes the counselor to unintentionally impose their own values, assuming everyone shares them. A culturally encapsulated counselor may exhibit traits of defining reality using one set of cultural assumptions, being insensitive to cultural variations, failing to see other viewpoints, making little or no attempt to accommodate the behavior of others, and/or resisting adaptation by rejecting alternatives. Encapsulation can also include ignoring societal development when assessing a client. To avoid having an encapsulated mindset, become more aware of your own culturally learned assumptions with an understanding that culture controls our lives and defines reality uniquely for each of us. The textbook encourages therapists to become globally literate persons, which involves making cultural diversity a core principle, making a commitment to social justice and social responsibility, while accepting there is no one best way to live for all. There are many examples of the high cost of cultural encapsulation and the ways in which it can negatively affect client care. For example, a clinician may take silence from a patient as a lack of interest, when the reality could be the client's culture considers it polite to pause and to think before answering, thus affecting the clinician's judgment in treatment or diagnosis. Likewise, commitment to cultural competence can improve patient outcomes by improving a trusting relationship with their counselor, as well as increasing the counselor's ability to identify with their client. For example, a clinician who pays attention to their client's low socioeconomic status does research to be able to provide therapy resources actually accessible to the client. Ethics codes from a diversity perspective focus on the counselor's responsibility to recognize the needs of diverse client populations and the necessity to develop culturally responsive practices since culture influences every aspect of a person's existence. A comprehensive listing of ethics codes addressing diversity can be found on pages 113 and 114. Two examples are listed here: the American School Counselor Association and the American Mental Health Counselors Association. When evaluating a range of cultural values and assumptions in therapy, which are conflicts between values in traditional counseling approaches and values of culturally diverse groups, it is crucial to approach the process with sensitivity, awareness, and a commitment to providing culturally competent care to avoid conflicts. These approaches include a range of steps, including improving a knowledge base of your client's cultural background, avoiding ethnocentrism, which is imposing your own cultural norms and values, embracing cultural relativism, which is understanding different cultures have unique perspectives and practices, having respect for family and community dynamics like family structure, spirituality, and religion, respecting the intersectionality of cultural identities and the ways in which these intersecting factors contribute to your client's experiences and worldview, and using the cultural formulation model in the DSM-5 to assess cultural factors that may impact diagnosis and treatment planning. Ethical issues pertaining to sexual orientation are important considerations when working with individuals of diverse sexual orientations. These include adhering to anti-discrimination policies, providing affirmative and supportive therapy, utilizing informed consent, respecting a client's autonomy in relation to their sexual orientation, safeguarding confidentiality, encouraging a client's voluntary disclosure without coercion, providing resources for clients considering coming out, creating a safe place for discussion, handling the therapist's own value conflicts with honest self-reflection, and advocating for the rights and well-being of individuals with diverse sexual orientations beyond the therapeutic setting. Counselors are uniquely positioned to make changes within their institution that result in a safer environment for LGBT clients. Identifying ethical issues and working with people with disabilities is critical for counselors. The disability community is a diverse population, encompassing a broad range of people with varying abilities, experiences, and identities. This vibrant population includes people with physical disabilities, sensory impairments, intellectual and developmental disabilities, psychiatric disabilities, and substance use disorders. Not all disabilities are visible. Advocacy and empowerment are critical for this population as they face many stigmas and challenges in life, including employment, communication, access, and the ability to self-determine and express autonomy. Counselors are uniquely positioned also to foster a more inclusive and supportive society for people with disabilities by acknowledging their rights and abilities and the importance of removing societal barriers preventing their full participation in society. There are many opinions on the importance or not of matching client and counselor multiculturally, with some asserting barriers make successful multicultural counseling highly improbable, and others believing that counselors who differ from their clients can be effective if well trained. It is not a possible feat to perfectly match a client and counselor in all areas. Therefore, All therapeutic relationships are diverse in some areas. One barrier is predicting which factors are imperative for a client and therapist to share. Another is the consideration that no standard exists due to subjectivity, complexity, and dynamics of differences. The prevailing viewpoint is that the client's perception of differences in areas of diversity is the most important factor. Ertl et al. 2019 found other factors had more determination of a good therapeutic outcome. These include factors based on the severity of the presenting problems, language barriers, and gender congruence. Their recommendation is to focus on training programs in multicultural competence as the ultimate solution. Unintentional racism and microaggressions are two related concepts that produce demeaning implications towards clients on the basis of their race, gender, sexual orientation, ability status, and more. With unintentional racism, unexamined hidden biases direct a therapist's subtle and unconscious thoughts, leading them to cause harm to their clients. Racial microaggressions are brief and common exchanges that implicate denigrating messages of people of other races, whether intentional or unintentional. People of racial and ethnic minorities face microaggressions in everyday life that can negatively impact their well-being. In therapy, microaggressions perceived by a client often interfere with the therapeutic process and client improvement, especially if not discussed. The most common racial microaggressions are denial of bias and/or stereotypes concerning cultural issues, and avoidance of discussing cultural issues. These transgressions left uncorrected especially emphasize minimalizing cultural issues over validating a client's experiences. University of California, San Francisco, 2022, Office of Diversity and Outreach, research indicated that an unaddressed microaggression can leave just as much of a negative impact as the microaggression itself. This is a table developed by Wright and Chan of the Center for Addiction and Mental Health at the University of Toledo to show examples of a theme, a related microaggression, and the resulting message. For example, if the theme is color blindness, which are statements which indicate that a white person does not want to acknowledge race, the microaggression could be a therapist says, "I think you are being too paranoid. We should emphasize similarities, not people's differences." When a client of color attempts to discuss her feelings about being the only person of color at her job and feeling alienated and dismissed by her coworkers, the message is that race and culture are not important variables that affect people's lives. If a client of color expresses concern in discussing racial issues with her therapist, and her therapist replies with, "When I see you, I don't see color," the message is your racial experiences are not valid. Yet another theme is denial of individual racism, which is a statement made when whites renounce their racial biases. For example, the microaggression is a client of color asks his or her therapist about how race affects their working relationship. The therapist replies, "Race does not affect the way I treat you." The message is your racial ethnic experience is not important. Another microaggression in this area is a client of color expresses hesitancy in discussing racial issues with his white, female therapist. She replies, "I understand. As a woman, I face discrimination also." The message is your racial oppression is no different than my gender oppression. Our textbook authors, Corey et al., 2020, indicated a culturally skilled counselor recognizes their limitations and manifests a willingness to seek consultation and supervision, participate in continuing education, and, when appropriate, make referrals to a professional competent to work with a particular population. A culturally skilled counselor also acquires skills for effective multicultural intervention. They develop the skill to adapt and incorporate various therapeutic approaches, to address multiple facets of a client's unique needs and experiences, are attuned to interpersonal and intrapersonal factors for building rapport. Awareness, knowledge, and skills are meaningless without action. Those committed to taking action are willing to work and practice reducing the gap between knowledge and doing. The recommended dimensions in multicultural training include self-exploratory journey, didactic coursework implemented throughout the curriculum, internship with multicultural experiences, and experiential approaches. Diversity and multiculturalism are ethically and legally relevant to helping professions like counseling. The practice helps counselors to understand and respect the cultural values and beliefs of our clients. It creates an inclusive and culturally competent practice that recognizes and respects the uniqueness of everyone, and teaches empowerment and advocacy for clients. Multiculturalism is at the heart of one of the most important skills of a successful counselor. Genuinely meeting people with curiosity and compassion, where and for whom they are. When asked what would we change, challenge, or consider as a need to improve this area of ethics, Sam said, the stigma around people with disabilities is they are only their disability, when in fact many people with special needs are victims and need counseling, but may not be able to receive it due to their disability. Advocacy and support can help change the stigma around those with a disability. Per my own experience, growing up with special needs and people who have gone through traumatic experiences that are disabled. LaDonna answered, the challenges I see are the counselors attempting to create a therapeutic environment when they lack training in cultural competence. Counselors should self-reflect on their beliefs and biases before counseling clients of other cultures. Mindfulness of others' languages, verbal and nonverbal, and respecting differences of race, gender, sexual orientation, and socioeconomic status is a start. Yet, if we as counselors contribute to the discrimination by lack of knowledge, we are the problem. Paula's answer. My appreciation for the ethical and legal necessity of honoring multiculturalism and diversity in counseling leveled up when I stopped qualifying the effort as work and began thinking of it as an opportunity. One challenge is to create a multitude of opportunities for those discussions and to do so with diverse participants. When considering a counselor's utmost responsibility is to avoid doing harm to their clients, ensuring multicultural competence is a must for creating a safe therapeutic environment. We are, each of us, in agreement that necessary changes to improve multicultural living experiences must include policies and legislation, addressing economic disparities, improving media representation, and more. Finally, here are the references utilized in compiling this presentation. We are open to answering any questions and entertaining any comments, positive or otherwise, in the discussion post this week. Thank you for your attention.